What's up, guys? My name is Omarr, and today's topic is postpartum depression. So, what is postpartum depression? I'm sure it's a term that many of you are familiar with, but may not know exactly what it is. Postpartum depression is a mood disorder that can affect many women after giving birth. Some of the symptoms of postpartum depression include, but are not limited to, mood swings, feelings of hopelessness and anxiety, depression, excessive crying, difficulty bonding with your baby, thoughts of harming yourself, thoughts of harming your baby, and suicide. Now, usually symptoms of postpartum depression usually begin to develop the first few weeks after birth. But it's important to be mindful that symptoms can develop up to 6 months after birth. Now, postpartum depression should not be confused with the baby blues. The baby blues carry some of the same symptoms, but it's important to distinguish between the two. The baby blues are usually characterized by feelings of worry, fatigue, unhappiness, and being overwhelmed. The onset of the baby blues is usually 1 week to a month after delivery of your baby. It can affect up to 80% of new mothers and generally last anywhere from a few days to a couple of weeks. Now, symptoms of the baby blues are usually pretty mild and they generally go away on their own. Whereas with postpartum depression, the symptoms usually last longer, they are more intense, and usually require treatment. So now that we know what postpartum depression is, let's talk about what causes it or what may put you at risk for it. Now, there's no single cause for postpartum depression, but there are many things that can put you at risk for developing it. Risk factors for developing postpartum depression include, but are not limited to, having a history of depression or bipolar disorder, having a history of postpartum depression, having a stressful event during your pregnancy. For example, like say you deal with a death of a family member, or you get into a car accident, dealing with some type of stressful event during the pregnancy, having a complicated or difficult pregnancy, having a baby with medical problems, having mixed feelings about the pregnancy. Maybe it was unplanned, maybe you weren't in the right space to have a baby, having a lack of emotional support from your spouse, family members, friends. This can also put you at risk for developing postpartum depression. Having financial problems, with the baby there's added strain. When you have financial problems and you're welcoming a new baby into your life, this can also put you at risk for developing postpartum depression. So say you have symptoms and you think you may have postpartum depression. What do? Call your healthcare provider and set up an appointment. When you get there, your provider will be able to rule out or determine whether or not there are other factors that are causing your symptoms, or in fact, if you do have postpartum depression. If you do have postpartum depression, you likely will be referred to a mental health professional. Your treatment will likely consist of talk therapy, maybe cognitive behavioral therapy, interpersonal therapy, and or a combination of antidepressants. Now, typically with appropriate treatment, postpartum depression should subside within 6 months. So not saying it will take 6 months for it to be gone, but within 6 months it should be gone. It can take a shorter amount of time as well with proper treatment. Now I can't stress enough how important it is that you start and complete treatment if you are diagnosed with postpartum depression. This includes staying current with all of your appointments and taking your medications exactly as prescribed. Without proper treatment, postpartum depression can last months or even years. And if you don't complete your treatment, say you start and you kind of just stop and get over the treatment plan and you don't feel like doing it, it's very possible to have a relapse of that postpartum depression. So I can't stress enough how important it is to actually complete the treatment plan that your provider gives to you. Postpartum depression can have a negative effect on your baby because of your reduced ability to connect and care for your baby. And the consequences of this means that the baby can have problems with feeding, problems with sleeping, in the future maybe problems with their behavior. Also, it's really important for me to note, if you have postpartum depression, It does not mean that you're a bad mother by any means. It just means that you have postpartum depression. Period. Also, as a mother, reaching out for help can be a very difficult thing to do. Whether it's because of certain expectations put on mothers by themselves, society, or family members, there can be a lot of pulls that keep a woman from asking for help when she really needs it. I encourage you to ignore the shit out of those pulls and all those expectations if you feel like you're developing symptoms of postpartum depression, and seek out help. And I know it's easier said than done to go and seek out help, especially when it comes to things regarding mental health. Most people try to kind of like tough it out and grin and bear it. But for the sake of you and your baby's well-being, trust me, it's worth it to go and get that help if you need it. If you live with someone who has postpartum depression, or if you start to notice some symptoms of postpartum depression in a new mother, whether it's a family member, friend, whatever, spouse, I think it's important that you encourage them to go talk to a healthcare provider, because they may not go do it on their own. Also, as a spouse, friend, or family member, understand what you can do to help. Assisting with daily tasks or helping take care of the baby can help alleviate some of those feelings of being overwhelmed that a woman with postpartum depression may be experiencing. Also, do whatever you can to provide emotional support to a woman who may be experiencing postpartum depression. It's not an easy thing to go through for a mother. And being there for a mother during this difficult time can help her recovery time progress much quicker than if she's just doing it by herself. That's all I got. If you have any questions or comments, please leave them in the comment box. If you enjoyed this video, please like it, please share it. I'd really appreciate it. And if you really want to be an awesome person, subscribe to my channel. On YouTube, it's Mental Health for Us. Mental Health, FORUS. Again, my name is Omarr. Hope you guys enjoyed the video. Later, guys.